Good morning, everyone. My name is Makayla Woods, and today I'm going to talk to you all about Lyme borreliosis. Okay, so I'm going to talk about the background, the history, the causes, transmissions, like signs and symptoms, and then treatment and prevention. Okay, so the background. Lyme borreliosis is also commonly referred to as Lyme disease. It is the most common tick-borne illness, which means it's spread by ticks. And so these ticks harbor the bacteria that causes you to get Lyme disease. And so when the ticks bite you, they infect you with the bacteria, and it's transmitted into your bloodstream. And so if you notify your doctors as soon as you get it, it can be easily protected. So the history: in 1975, in Lyme, Connecticut, a recent outbreak of flu symptoms and arthritis was seen in lots of children and adults. And so this concerned the local physicians and doctors. So they started to do research on it. And in 1977, they linked the symptoms that most people were getting to ticks. And therefore, it was called Lyme disease. And so in 1997, they came out with a vaccine after they did years of research. And it was proven to work, and it was really good. But then in 2001, the manufacturer pulled it off of the shelves for some reason. Okay, the causes. So the bacteria that causes it is called borreliosis. And so it's carried by ticks, as I said before, and it's common in northeastern, the mid-Atlantic, and north-central parts of the United States. And so there's different types of ticks that carry it. The most common is the deer tick. And so it basically likes to be in places that are very wooded and not tropical, but with lots of leaves and different things like that. Okay, so transmission. So the ticks that cause Lyme disease, they can't fly or jump or anything like that. Instead, they just wait on leaves, and when the host walks by, so a person or a dog or an animal, they just attach themselves. And so then they stay on your skin, and they have to be attached for 48 hours before the disease, the bacteria, can be transmitted. And so as of now, there's no way that Lyme disease can be transmitted person to person. So by kissing and touching, Lyme disease can't be transmitted. It's only from the tick to the host. Okay, so my experiment that I researched was on the ways that Lyme disease can be transmitted. So basically, they took 2 different mice and they transmitted Lyme disease to them. And they put them in a cage with other mice, and they tried to see if just regular engagement would get the Lyme disease to transmit. So after 48 days, they took the mice and did all different tests on them, and they all came back negative for Lyme disease, which shows that Lyme disease can't be transmitted from human to human or person to person. Okay, so signs and symptoms. In Lyme disease, there are 2 different stages. There's the early localized stage and the early disseminated stage. So in the early localized stage, you get flu-like symptoms, so fatigue, joint and muscle aches, headaches, chills, and fevers. And so those are just typical flu symptoms, so you might not think you have Lyme disease, but you actually do. And you'll also get an EM rash, and the EM rash is also commonly referred to as the bullseye rash. And it's basically a bullseye pattern from where the tick bit you. And so it's normally warm to the touch, and it doesn't itch or hurt, it's just there. So in the early disseminated stage, it's when the infection is untreated for a long period of time. So you'll see more EM rashes in different places besides the tick bite. You'll also get headaches, stiffness, dizziness, and shooting pains throughout your body. And so this is really dangerous because this could lead to Lyme carditis, and this is where Lyme disease infects the nervous system and your heart. So this Lyme carditis, as I said before, is the bacteria when it enters the heart tissue. And so this is really dangerous because your heart is like, what controls your body or like pumps blood. So it can lock up your heart and it can stop the blood from flowing, which can be really dangerous, but it can be cured with antibiotics. And so you'll have to take at least 14 to 21 days, and then you should start seeing the symptoms like clear up. Okay, so the treatments. So the main treatments, as I said before, is just antibiotics. And so there's oral antibiotics. And so this is the standard treatment. And it's for adults and children, and then women who are pregnant or breastfeeding. And so this is standard treatment, and it's not dangerous, and I believe it's weeks of it, and then you would start seeing the symptoms recede. Okay, and then in the intravenous stage, this is when your nervous system is affected by the Lyme disease. And so this is a more serious antibiotic. And so this can completely remove the infection from you, but it also has some side effects. It can lower the white cell blood count in your body, and it can also lead to severe diarrhea. Okay, so prevention. Prevention is just basically when you're going to wooded areas, just to wear long pants, bug spray with DEET in it, so the bugs aren't attracted to you. And this is just to prevent you from getting Lyme disease and other insects. And this concludes my presentation.
Why was the original vaccine called?
I'm not actually sure why it's recalled. I think it had some different problems with it, and they just decided to use antibiotics instead. Yes.
Is it particular to any race or?
No, it's just anytime you go into the woods or wooded areas, you have a higher risk of getting it. Yes.
Do you know of any other manufacturers that decided to start doing more research into the Lyme disease vaccine?
I'm pretty sure there are some who are doing research on it, but as of right now, antibiotics is the only treatment for it.